Hi, I'm Cecilia Wallace, SBT, and today I will be instructing Skill 41, Ambulation with a rolling and standard walker. To begin, proper setup, please refer to the handout, and Skill 40 for proper fitting of the walkers. When the patient is initially learning how to ambulate with a walker, the healthcare professional should always contact guards towards the patient with a gait belt on the patient, one hand posteriorly on the gait belt and the other hand anteriorly on the shoulder girdle. The healthcare professional should also be using verbal cues such as good leg, bad leg, walker. When ambulating with a standard walker, the patient should begin by removing all four legs from the floor, lifting up, and then placing the walker one pace forward just past their toes. For a rolling walker, the patient should begin by lifting the two back legs up and then rolling the walker one pace forward just past the toes as well. Also, when ambulating with the affected or injured limb, the patient should place as much body weight through straight arms onto the walker as needed. For forward ambulation, the patient will begin by moving the walker one pace forward. For partial weight-bearing patients, the patient will first move the affected limb forward, pushing through the walker with their hands as much as needed. Then they will move the unaffected limb forward to meet the affected limb. For non-weight-bearing patients, the patient will place their full body weight onto the walker through their hands and move their unaffected limb forward. This is a step 2 gait pattern. Walker, bad leg, good leg, walker, bad leg, good leg, walker. Walker, bad leg, good leg, walker, bad leg, good leg. This is a swing 2 gait pattern. Walker, push, walker, push. Walker, push, walker, push. For backwards ambulation in partial and non-weight-bearing scenarios, the patient will begin by using the unaffected limb one pace backward and then bringing the walker back to meet them. Good leg, bad leg, walker, good leg, bad leg, walker. Good leg, bad leg, walker, good leg, bad leg, walker. Push, walker, push, walker. Push, walker, push, walker. For sidewise ambulation, for instance, when moving to the right, the patient will first move the right limb, whether it is partial weight bearing or the unaffected limb, and then move the left leg and then move the walker in the direction of the movement. If it is partial weight bearing, the limb that is being moved, the patient should place as much weight onto the walker with their arms as needed. If it is a non-weight bearing scenario, then the patient will have to push all their weight through the walker to move the one limb that is available to move to the right. Right leg, left leg, walker, right leg, left leg, walker. Push, walker, push, walker. To return to sitting, the patient should first use forward ambulation to arrive at the chair, and then use a combination of sidewise ambulation via pivoting on their unaffected limb and backwards ambulation until they reach the chair and can feel the chair on the back of their legs. They should then reach back for the chair with their arms, and you can refer to Skill 40 for proper sitting technique. Okay, walker, push, walker, push, walker, push. Okay, so we're gonna turn now, so you're gonna use your good leg to pivot. So walker, push, walker, push. Now we're gonna back up until you feel the back of your legs on the chair. So push, walker, push, walker. Okay, you feel the back of the chair. Okay, reach behind you for the armrests, and I'm gonna lower you down.